Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my uncle is on BiPAP after 2 weeks on the ventilator, and the doctors think that putting the breathing tube back in is futile. What does it mean? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is: my 29-year-old husband is in intensive care with a brain injury and fractured legs. He's been in an induced coma for 4 weeks and he has been septic. Will he be okay? This question from Alta formed part of an email consulting counselling session with me. So Alta writes: Hi Patrick, I'm the wife of an army officer. He's 29 years old. 40 days ago he had an accident with a head injury. The doctors operated on him and the operation went very well, and the doctors put him in an induced coma. The CT scan of the brain showed that he doesn't have any brain injury, but he had a severe leg infection, and they kept him in an induced coma for 1 month. My husband has never been ill in his life before, and he can't talk yet because they haven't closed the tracheostomy yet. 2 days before he had plastic surgery in his leg. He was in a septic condition during all this time. Then they woke him up and he responded very well. He seems to listen, and when I come closer to him, he kisses me on the lips. He doesn't need mechanical ventilation anymore. He has never been taking drugs or alcohol, and he was physically very strong. How long do you think it'll take him to come back to normality? The doctors woke him up a week ago, then they operated on his leg 2 days ago with general anesthetics. They closed it up and now he doesn't have sepsis or infection anymore on his leg. I hope that makes sense, and I'm sorry if I'm not too clear. So basically, my husband had an accident in which he injured his head and crashed the right leg. The doctors operated him urgently for the head injury and left his tibial fracture and wound untouched. Then they put him in an induced coma for 6 days, and after that they woke him up. But by that time he was still on mechanical ventilation. After that they left him awake for 3 days. Then he had his leg operated for the tibial fracture. They woke him up again after the operation, but the wound in his leg got infected and had sepsis too. So they put him back to sleep and they did the tracheostomy. His situation became worse and worse. They medicated the infection with IV antibiotics for 2 weeks and now he's okay. But they decided to operate his leg at the plastic surgery department. All his organs are functioning very well, and now he's awake again as I write to you. Today, besides recognizing me, he seemed to confirm what I said by shaking his head. I hope I have been clear. Many thanks, Alta. So, here's my response. Hi Alta, thank you for your email and for your inquiry. And thank you for signing up to my email counseling and consulting service. I'm very sorry to hear what you and your husband are currently going through. Being in an induced coma for 1 month is a very long time. However, if your husband is now awake and is recognizing you, that's very encouraging. If your husband was septic because of his leg infection, it's probably the reason why they kept him in the induced coma. Even though 4 weeks is a long time for an induced coma, if he was septic and they didn't If he was septic and they didn't want to take the risk of operating on his leg, it was most likely the right thing to do. It's nothing unusual that fractures are not getting operated on straight away in a critical care environment if patients are unstable and have other injuries or fractures that make it too risky. Leaving critically ill patients in an induced coma during those periods when it's too risky to intervene and do procedures makes sense, and it often gives patients time to heal and rest. Especially with sepsis, it's good that they didn't take the risk and taking your husband to theatre for operating on the leg. On top of that, given that he had a brain and a head injury, it was probably wise to leave him in an induced coma for a bit longer so his head and brain had time to rest and heal as well. After such a long critical illness with sepsis, your husband will need time. It's very encouraging that he recognizes you and that he can confirm what you are saying. Being in an induced coma for so long with sepsis can take its toll, and it will most likely take your husband some time to fully recover. However, it's a good sign that after the plastic surgery he didn't go back on the ventilator. It's also a good sign that he's not septic anymore. Therefore, it was wise to not operate on the tibial fracture, get the IV antibiotics going first, treat the infection, sepsis, and then operate on it. Recovering after a long-standing critical illness can take time. You need to be patient, and it's often 2 steps forward and 1 step back. The most important thing that I can see is that your husband doesn't have any brain injuries, therefore he should be able to fully recover. This might take time, but your husband's first goal is to get out of intensive care first, and it sounds to me like he's not too far away from achieving that. Also, keep in mind your husband will have lots of medications from the induced coma and from the general anesthetics in his body that will most likely slow him down as well. Again, 1 step at a time, day by day and often hour by hour. It's important for you that you keep your sanity and that you stay positive. And we have lots of supporting articles and videos on our website to stay positive, and I've also put a link in the article below that will help you to understand what's happening as well as it relates to waking up after an induced coma and how long it can take. I really hope that clarifies, Alta. Any other questions, please let me know. Wishing you and your husband all the very best. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insights so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on our contacts tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype, over the phone or via email by clicking on the appropriate tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.